I'm standing at the kitchen sink washing dishes. From the back of the house, I hear, "Mommy, Mommy, Mommy, it's Ash. You have to help him." Ash is my 15-year-old daughter's hamster. As she hands me this lifeless hamster, I realize he's not breathing. Although I'm only trained on humans, I take my mouth and I cover his tiny mouth and nose and take the tip of my finger and compress his tiny chest. CPR is probably one of the easiest things for someone to do for someone who's in cardiac arrest. As a nurse, I have to renew my certification every 2 years. Even in school, before we became a nurse, we had to practice, and the hospitals also required us to do what are called practice codes to ensure that we could do CPR efficiently. The first thing that you would like to do when you come up on a scene is to make sure that everything is clear and try to wake the patient, try to get them to arouse. You can call their name, you can shake them. The best way to do, if you can't get that to work, is to take your knuckles and just rub the chest. If this doesn't work, they're probably in some type of cardiac arrest and you want to call 911 immediately. If you're not alone, you can pick someone specific out in the crowd and make them call. After you have had someone call or you've called, you want to kneel beside your patient, close to the head. You want to tilt the head back and make sure that the airway is clear. Take your 2 fingers on either hand. It's best to do the opposite hand, and check the pulse. It's just beside the airway on either side of the neck. As you're doing this, it's easy just to lean down and check and make sure they're breathing. If you see the rise and fall of the chest, they're breathing and they have a pulse, they're probably okay, but let EMS come and check them out anyway. If you don't feel either one of these, they're probably in some type of cardiac arrest, and CPR is what's best. You want to do compressions at a rate of 100 to 120 beats a minute, and you want to do it about this fast. The song is called "Staying Alive" by the Bee Gees, and it's the best way to time yourself. The way to start CPR is to take one hand, cup it over the other, and go to the middle of the chest in between the nipples. Look something like this. If at any point in time your patient wakes up, starts coughing, or has a pulse, you want to back off of CPR, but you still want to wait until EMS arrives to make sure the patient is okay. Again, CPR is probably one of the easiest things any person can do to help save another life. And if it hadn't been for CPR, I would have had one very upset little girl that day. Thank you.